Hi, this is Mark Cushing, and welcome to now the fifth episode of Mark 5, Policy Off Leash, where I try to, in 5 minutes or maybe a few more, go through the basics about the issues or policies or questions people have regarding telemedicine in the United States, what you can do, what you can't do, and where it may be going. The last episode, we talked about Ontario in Canada, which has legalized VCPRs through telemedicine. And we've got the benefit now of the Ontario VMA's summary of what's happened in 2 years up there, closer to 2.5 years now. And we put that on our website, vvca.org, and I hope you have taken a look at that. Today, we take on a topic that has been the subject of a lot of conversation, some webinars, but probably more uncertainty than anything in the US, namely, what kind of veterinary technician, or as we shorthand it, a vet tech or a veterinary nurse, what role can they play? What are they allowed to do or not do when it comes to telemedicine? So we'll talk about that for the next few minutes, and I hope this is helpful. You start with veterinary practice acts. And everyone watching who's a vet tech or a veterinarian knows that every state has a veterinary practice act, and it lays out the rules of the road. It regulates how you get to be a vet tech or a veterinarian, what you can do or can't do. And the main thing about veterinary practice acts when it comes to vet techs or vet nurses across the country are what I call the 3 no's, the 3 things vet techs cannot do. You cannot perform surgery, you cannot prescribe medications, and you cannot diagnose or offer a prognosis of a condition for an animal, in particular a pet. Those are the 3 no's. By the way, nothing with respect to those 3 no's is changed by telemedicine. Those are the basic rules that say, we'll let you do these things or let you do a lot of things, but you can't do those 3 things. The other thing, though, that a Veterinary Practice Act does when it comes to vet techs is it basically looks at the relationship between veterinarians and vet techs and has, again, some rules of the road about what vet techs can and can't do. Something by way of guidance, if you will, about the oversight of veterinarians over vet techs. I'm going to stop there because that's all that practice acts do. I'll talk a little bit more about the relationship between veterinarians and vet techs at the end of this video cast. But practice acts don't basically describe everything a vet tech in the morning, all afternoon, in the evening is allowed to do or not do. They simply say, in the world of medicine, specifically using that term medicine, here's what you can't do. And with respect to a veterinarian, here's what you can do, all right? There's a wide world, almost an infinitely wide world of advice and guidance and questions to be answered that a vet tech or a vet nurse can supply through telemedicine. Whether it's a phone call, a Zoom call, FaceTime, a text, any means where the person's somewhere else than in the room that the vet tech is in, which is what we call virtual care or telemedicine. Through whatever means they contact the vet tech, you can provide information and guidance to a pet owner on almost an unlimited range of topics. And because you have been a vet tech, you've been trained in schools as well as trained in practice. And obviously you love animals and you're willing to put up with all the challenges of being a vet tech or a vet nurse, you're a great resource. Perhaps as good a resource as exists anywhere to answer pet owners' questions. New pet owners, what do I feed my puppy? How do I get him to sleep at night? You know, what do I do if he's making these noises or that noise and so forth? To behavior, my cat's destroying a wedding gift we got from my parents of a beautiful couch. How do I stop that? And the list goes on and on and on. And there's nothing in a practice act, and I want to repeat that, there is nothing, 0 in any practice act that restricts a vet tech from taking that phone call or being on that Zoom call or answering that text message and providing valuable guidance, experience guidance to the pet owner. And it's important that vet techs and vet nurses know that. It's equally important that veterinarians understand that. And if you're not using your vet techs, whom you have confidence in, obviously, or they wouldn't be working for you, if you're not using your vet techs and vet nurses to provide that kind of advice, if you permit me, you're making a mistake. You're not using them to the level of knowledge and skill they have. And as we humans find in talking to nurses about medical issues, you're denying pet owners a valuable resource that they would frankly appreciate. And if you're tired from a long day and you don't have time to take those telemedicine or virtual care engagements, and you're trying to get home after a long, long day as a veterinarian, it's your own fault, to be blunt, if you won't use your vet techs to provide that wide range of advice on a whole host of topics, as long as what? As long as you don't cross the line regarding surgery, prescribing medications, or a diagnosis or prognosis. So let me finish with one aspect of Practice Acts that has a relationship to the connection between veterinarians and vet techs. And that has to do with supervision. The word supervision is used in virtually every Veterinary Practice Act. And it describes across the country, with no real difference in definitions, 3 levels of supervision a veterinarian can or should provide over a licensed, registered, certified vet tech. Number 1 is indirect supervision. Number 2 is direct supervision. And 3 is immediate supervision. What's that mean? Indirect supervision always means one thing. Whatever the vet tech's doing with a patient, with a pet or an animal, the veterinarian is not required to even be on the premises. So the veterinarian could be fishing in Alaska, but if they're reachable by phone, vet techs can do what they need to do with the patient in the clinic, for example. The veterinarian doesn't have to be there. That's called indirect. And by the way, in those indirect supervision circumstances, which in some states, like the state of Washington, are spelled out in great detail, all of that can be done through a telemedicine framework, meaning the veterinarian can be visible on a screen or visible via a phone, and that's adequate. And you're free to do what you need to do. Direct supervision means the veterinarian's on the premises. And there's a good question there. Since I'm a lawyer, I like these kind of questions that lend themselves to some ambiguity. Is the purpose of being on the premises so that the vet tech can ask questions and get the advice of the veterinarian? Or is it because there may be something occurring to the pet that's life-threatening and you want the veterinarian to be in the room? If you see it the latter way, telemedicine doesn't fit. If being present could mean live video, so you're in the exam room number 1, there's a screen and the veterinarian is watching, would that satisfy the test of direct supervision? I think that's going to be tested in the next few years. No one's ever been asked to, at a state board level, answer that question now, or up until now. The third category, immediate supervision, sounds like, it means what it sounds like, right? The veterinarian's in the room, often involving surgery, and there's anesthetic procedures going on, and the veterinarian needs to be right there. Obviously, telemedicine doesn't fit in that circumstance, and I don't think anybody credibly can make that argument. So to step back, what have we learned? That Practice Acts define and limit, but they don't cover everything a vet tech can do, and you want to be mindful of that. Vet techs have knowledge and can provide guidance on a range of topics to pet owners, and should be encouraged to do that. And pet owners will not only welcome it, they'll pay the practice to have that service. And third, levels of supervision may be able to involve telemedicine, except for the case of immediate supervision and in some circumstances, direct supervision. I hope this has been helpful. We'll see you next week on Policy Off Leash. This is Mark Cushing. Thanks. If you want more information or even more fun to engage in an extended conversation with your colleagues about these issues, go to the Veterinary Virtual Care Association or vvca.org website, where our 3,600 member strong organization is engaging on all topics that concern telemedicine and virtual care for veterinary practices, not just limited to the policies I'm discussing, but how do you use it best? How do you implement it? How do you train your staff? What are the proper roles for all the staff members? And actually, importantly, how pet owners have reacted to it. We'll see you next week. Thanks.